Quality improvement programming is mandated by the federal regulations, and all homes have to comply with that if they receive Medicare funding. Now, nursing homes that have an organizational culture that emphasizes innovation, teamwork as they review their quality indicators, are homes that are much more likely to put in place evidence-based practices for the care of their residents, and thus they'll have better outcomes.
We carefully designed feedback reports on hospitalizations and on all the key variables that we're studying, like advanced directives. We designed the reports to make them very simple to understand, and then we were responsive to the homes if they wanted to be able to design other reports that would be available.
Nursing homes gather clinical data on a number of indicators: falls, pressure ulcers, infections, even staffing call-ins. But homes need to look at an additional indicator, and that is the transfer of residents to a hospital or an emergency room. Research tells us that these transfers are largely unnecessary and avoidable. Homes need to begin doing that deep dive, if you will, into each of their transfers and identify what the cause of that transfer is. In our project, we've identified 6 clinical conditions that are probably the most common that residents experience when they're transferred: congestive heart failure, chronic obstructive pulmonary disease or COPD, pneumonia, dehydration, skin infections or skin ulcers, and urinary tract infections. They need to also collect many more pieces of objective facts about each transfer to help them do a really careful, complete, comprehensive analysis. So things such as, what unit was the resident residing on when he transferred? What was the date and time of the transfer? Who was the provider who ordered it? Who was the nurse and CNA caring for the resident at the time of transfer?
We break it down and look at the raw data, and then we go back and evaluate those specific situations. Sometimes you need to do a root cause analysis.
A root cause analysis is a technique that you use in quality improvement. Keep digging until you find the real root cause. What you have to stop staff from doing when they first learn this technique is they hit the first thing or the second thing they think of, and that's the cause. And it's not. You've got to actually ask 5 whys. Why this? Okay, now why that? Now why that? Now why that? Now why that? And you're probably at the root cause if you go 5 deep into the problem.
That's where an APRN can play a key role. They can bring the data that they find to the quality team and analyze it together in innovative ways that help identify what changes do we need to be putting in place here, or what adaptations do we need to be making in order to prevent these transfers in the future. Do we need to change certain systems that we have in place or certain processes? Do we need to educate the staff about certain things so that they're able to identify those changes early enough so that we can institute treatment safely and early to avoid the trauma of that transfer?
We have a structured program to eliminate, essentially, for the most part, hospitalizations for people who are having exacerbations of CHF. And so the tools that we use in the program and the feedback data have also helped us to hone in on those types of diagnoses, those chronic diagnoses that lead people to go to the hospital.
If homes can do that careful, comprehensive analysis with the goal of reducing those transfers, then they're going to save time, they're going to save money, and they're going to have great satisfaction scores from their staff, from their residents, and from their families.